A gala evening to celebrate the best healthcare brands in the country. The Economic Times Best Healthcare Brands was organized recently in the national capital to recognize the brands which have made a mark in the healthcare domain. The initiative brought together some of the brightest minds from across the medical fraternity to celebrate and acknowledge what goes into making India's most prominent names. Siddharth Nath Singh, Minister Medical and Health, Uttar Pradesh, graced the event as the chief guest.
And I'm grateful to Economic Times for giving me this opportunity. It's an occasion where we are welcoming and celebrating the brands. And I presume after this, I'll be also introduced to those who are getting the awards. So many congratulations to those. I have an experience of ensuring that the health services in Uttar Pradesh are out of the ICU in your terminology. So it's been a very challenging job, and I still continue to work hard. But I think the first and the most important thing for any minister or any doctor or anyone in the public health services, you do need to be emotionally attached to that job. This public health service is just not an ordinary service. It needs a lot of your emotions to come out, and then you come and do service. And I think that's the only way the results can be obtained. I welcome you all and thank you very much for calling me here. And to the audience also who has given a patient hearing, thank you very much.
After the chief guest address, it was now time to acknowledge brands that have created a name for themselves in the healthcare industry. But before that, here are some of the glimpses from the launch of the Economic Times Best Healthcare Brands Coffee Table Book. After the launch, it was time to acknowledge the efforts of those brands that have proved their mettle in the healthcare industry.
I'd like to request all of you to welcome Asian Institute of Medical Sciences. Please put your hands together for Care Hospitals. Taking the Walk of Fame next is Cetaphil. May I request all of you to please put your hands together for Cofsils. Taking their brand forward in the healthcare segment is Columbia Asia. Taking research and laboratories to an all-new level is Dr. Lal Path Labs. Please put your hands together for Albert Medical Diagnostics. Let us now put our hands together for Elements Wellness, joining us on stage next. Please put your hands together as I now request the team from Fasten Up to join us here on stage. Here's yet another team here to accept our congratulations and more. Fredon Pharmaceuticals joining us next. Please put their hands together for Fusion Healthcare. Ladies and gentlemen, a round of applause for Fusion Healthcare. Put your hands together for Grewal Eye Institute. Please put your hands together for the Economic Times Best Healthcare Brand Herbal Life Nutrition, working towards overall holistic nutrition. Now I'd like to welcome the team from KCI Medical India to join us on stage next. A round of applause as Sir steps on stage. Let's now welcome KIMS Healthcare Group. Creating better vision, we have with us Lotus Eye Hospital. now like to welcome Metra Hospitals to join us on stage. Creating a better environment for animals, making sure that their health is in our hands. Please put your hands together for Natural Remedies. Let us now welcome Smith & Nephew's Navio Robotic Surgical System. Ladies and gentlemen, a proud team joining us on stage. Brand that we'd like to acknowledge. They work on good health and more, and creating better taste with Neutralite. Ladies and gentlemen, a round of applause for the Economic Times Best Healthcare Brand, Ostim Implant. I'm sure all of us agree that personal care is so very important part of better health. So please put your hands together for Saint Botanica. Ladies and gentlemen, joining us next on stage is Sugana Hospital. May I request all of you to please put your hands together for the Economic Times Best Healthcare Brand, Vital Imaging Center. May I request all of you to please put your hands together for Health Yarns. Let us also welcome on stage Oknet Healthcare. A round of applause. Taking personal hygiene to an all-new level with P-Safe, may I request the team to please join us on stage. Please welcome Surya Healthcare, joining us next on stage as yet another emerging brand. I'd like to welcome the team from BPL Technologies to join us on stage. May I request all of you to please put your hands together for them. May I request all of you to please put your hands together for Harpik, Rekordbenska, India.
The Economic Times Best Healthcare Brands has created a platform to discuss how the Indian healthcare market is evolving and how healthcare companies are gearing up to meet the growing demands. Smith & Nephew is one such company which is spreading its wings in the Indian market.
Smith & Nephew has made a host of acquisitions of late in the last few months. Can you tell us something about the long-term objectives and the vision of the company for going forward?
So part of what we try and do is really improve our portfolios over time. And with a very strong balance sheet, we have been able to make some acquisitions recently. Each of them strengthens our core businesses. Most recently, we've done 2 acquisitions for our digital surgery and robotics area, and also quite a big acquisition in the wound management space. So they help us to be more relevant with our customers and help them solve their problems every day clinically.
In your view, how has the digital ecosystem and robotics, changed the healthcare ecosystem in Asia?
Well, in Asia and actually all around the world, digital surgery and robotics will help the quality of the clinical outcome. We're going to get more reproducible results by using these technologies. And we see in India a very strong uptake of the technologies with some of the leading surgeons operating right out of here in Delhi and around India. So we see these technologies as things that will be present all around the world, not just here in India, and certainly things that will help clinical outcomes.
What is the advice that you would give to leaders in emerging markets like India who are extremely keen to grow their careers and take up senior leadership roles in the future?
Well, first of all, to be very realistic, start with doing your current job very well. And then as you do your current job very well, prepare yourself for your aspirations and look beyond India. I think if getting experience outside of India in other markets and in other technology areas, they're useful things to gain experience and therefore be more useful in corporations like ours and global corporations.
The healthcare industry is growing at a brisk pace, resulting in becoming one of India's largest sectors. Many private players in this domain are offering the best of products to Indian consumers. Rohit Shilatkar from Vita Biotics sheds some light on this.
Tell me a little bit about the company.
So Vita Biotics is UK's #1 and fastest growing vitamin company with a very unique portfolio of products, right at the forefront of technological development, scientific development in the areas of nutrition and particularly women's health. We've been around for 48 years now. We've been in 110 countries, and in most of these markets we're #1. The unique thing about Vita Biotics is all our products are clinically tested, and we work with major universities around the world to do our clinical testing. The products are manufactured to very high pharmaceutical standards of GMP, and we take about 30% of the market share in the nutraceutical market. And some of our brands in the UK take up to 90% of the market share.
Tell me a little bit about the India plans. What's happening in India? What's the way ahead for the India specific market?
The Indian market is really big as compared to anywhere else in the world. If you can sell anything in big numbers in India, it becomes the world's #1 today. And the awareness of nutrition is growing in India as many other fields, and that's why we see this as a very important market. The Indian healthcare market, particularly supplement healthcare market, is about $1.5 billion, which is like in the top markets in the world. And our focus would be, one, on research. We make products which are innovative and which suit the demanding lifestyle of Indian population. Number two, we're going to bring about educating people. We want to educate people, not only the medical fraternity, not only doctors and pharmacists and nutritionists, but we want to educate general people through direct consumer marketing, and that's really important. And number three, we want to make sure that the product is available everywhere, so not just metro cities, but it should be available in the interiors at an affordable price.
Are you tweaking some of your products to make them more India-centric, because Indians have a different genetic makeup as opposed to maybe the British that you've been, that's where you're based, where the company is headquartered?
Consumer demand is different in different countries. You know, there's a lot of vitamin awareness already in the West as compared to India. So you have to think from that point of view. But a population that has not been already very exposed to the supplement industry or good quality supplements would consume anything that comes. So it's very, very important to educate people what is right for them and what do you mean by a good quality supplement. You know, you need to have clinical data backing your claims. You need to have products manufactured to very high standards of pharmaceutical quality and all that. Otherwise, in general, I think as human beings, we all need the same 7 or 8 important things. We need good sleep. We need an alcohol-free or a smoking-free life. You know, you need stress-free life. You need to have your fruit and veggies. You need to exercise, you know, about half an hour every day, etc. So the demands remain the same. Maybe the market is a little less matured as compared to the West in terms of supplements.
In India, how are you at Vita Biotics going to ensure that, you know, like you said, the important part is the awareness, the information has to go, because if somebody is misguided at first and they use any XYZ product, then they're put off for this full segment completely. So the important thing is to get them to use the correct quality in the correct quantity products. So what's the plan for that?
You know, the entire innovation and research at Vita Biotics has been guided or fueled by the intention of delivering natural healthcare solutions to problems in the most effective way. So the product should be safe, the product should be effective, affordable and easily available, and with the right technology, with the right science, etc. In fact, we've been given a Queen's Award recently for our vitamin research. I mean, 60 years of history of Queen's Award, only twice a Queen's Award has been given for research, and both the Queen's Awards for research in vitamins are with Vita Biotics. Now this is, you know, this is the biggest certificate of your credibility.
Finally, Rohit, what is the way ahead for your company in India?
Indian market is growing incredibly fast, and it's very hard to keep up with the changing trends and all that. we're going to invest, as I said, more into research, more into bringing products that are, that are effective, that are safe, that meet the demand of the population, and that are available at an affordable price. So that's a big task, and we have to grow with the market. So if the market is growing, it's a very big market. We want to make sure that we bring innovative products. We've always done that around the world. We want to replicate that. I'm very, very sure that the Indian audience is going to reciprocate. When they see good products, when they see science, they accept that. So huge plans for the Indian market.
Fantastic. Well, we wish you all the very best for the way ahead. Thank you so much for talking to us.
Thank you.
Thank you.
India is at the forefront of providing the best of healthcare treatment and services, as one needs to understand the expectations and demands of the patients. Rajiv Singhal from Evercare Group elaborates more on this phenomena.
How are advances in models of delivery, innovations in access, and consumer awareness, or maybe even expectations, shaping the healthcare sector in India?
So we are at a very crucial junction of our healthcare system where there is a lot of advancement which is taking place. At the same time, there is a very important factor which is growing faster than other advances, is the trust deficit of the people on the healthcare system. The time has come where we should understand that our consumer is an aware consumer. The patient is far more knowledgeable, and patient has right to ask more questions than they used to do it 20 years back. Until as all the stakeholders, the doctors, the nurses, the people in the healthcare system agree to that, it will be very difficult for us to carry the momentum of this fast changing environment of Indian healthcare. So it's important we create access, we create affordability, we give quality healthcare to the people of this country. At the same time, be cognizant of the fact that awareness is a right which patients enjoy, and we should cater to that.
Can you tell us something about the Indian healthcare ecosystem, in terms of trust and transparency?
So trust and transparency, the expectations of the patients are that we should communicate to the patient what we are doing to the patient. It is the right of the patient, rather than simply writing the patient needs an investigation. Clinicians and all the healthcare providers are supposed to and should invest some time in explaining and communicating with the patients. It's important. They do not come to the hospital just because they want to visit the hospital. They are in pain, they are in agony. So it's important that we invest time in explaining to them. That is part one of it. Moment we start communicating to it, it will lead to building more trust. As far as quality is concerned, I think we should feel proud of the fact that if we look all around the world, majority of the doctors in whether in NHS system or in US system, majority of the doctors are of Indian origin. The system of education of Indian healthcare was not bad, is not bad. We produce wonderful doctors, skillful doctors. At the same time, people scout for Indian nurses. The two main pillars of Indian healthcare, that is the nurses and the doctors, if they are the best people, if we provide the right platform with communication skills developed on these people, I think we are there to beat the world. But at the same time, I would like to put a caveat, there is always, quality is a journey. This is not where we have reached. This is not the destination where we have reached. We should continue to focus more on quality and audits and quality and audits.
We see today's consumer, they are really evolved and also well informed about the skincare needs. And if you talk to the Indian consumers, they know exactly what to expect from a skincare product. If you see the consumer industry today, they are really very well evolved, and also again they are really looking for challenges, and also in terms of coming out with very innovative brands to suit the consumer needs. Cetaphil as a brand, always we are ahead of the curve, and also again we are launching every time very unique, innovative and very differentiated new product every time. So how we are able to achieve that? We work very closely with the dermatologists, healthcare professionals, and also we do a lot of consumer insights. That really helps us to understand the consumer behavior and consumer trends, which really helps us to come out with more and more new products to help the changing consumer demands. And also one more new trend which is happening now is with regular exercise and also well-balanced healthy diet, and also now the people are looking for more essentially again for a healthier skin, right? So one of the biggest challenge for us as an industry is to whichever area, whichever new product whether we launch, whether it can be a new SKU or a new channel, we are constantly looking for innovation which is really going to the industry and also the patients in a big way. According to me, there are three things which are very, very important. One is again, first is constant innovation, which I spoke about in my earlier question, and second is efficacious and high quality product, and third is safe to use in all age group. If you see at Galderma, we are always looking, constantly mapping our consumers and coming out and also working with very closely with the healthcare professional to come out with constant innovative new products. And our R&D scientists always looking for, keeping always patients in mind and coming out with a lot of innovative products for the consumers. If you take Cetaphil as a brand, which has got a very strong medical heritage, which supported by such a strong scientific data, and also it's available in more than 100 countries, which really helps the patients in a big way.
Well, technology is here to stay in healthcare. In fact, it's been in healthcare for some time now, but over the last few years, it's been extremely disruptive. Let me explain. Firstly, in the hospital environment, you have technology which aids every form of diagnosis. Technology has also built up artificial intelligence, which enables better diagnosis and improved care. Technology also helps in providing remote care to patients. You have telemedicine, you have teleradiology, and very many other products that helps you to understand the healthcare needs of people who are in inaccessible areas. The other area that I would say is that technology helps you to take care of yourself. There are many aids, for example in diabetes, which allow the patient to take care of himself or herself, and this reduces cost of healthcare, it creates greater efficiency, and it is much more far-reaching in terms of its coverage. So I would say healthcare is aided immensely by technology to make it better, more efficient, and less expensive. Teleradiology catches my eye, and to tell you why, it enables the ever-shrinking number of radiologists to widen their ability to cover a much larger group of people. It is also a very important tool in many diagnoses of patients. And more importantly, it is the way of the future, because as we speak, AI is being built to enable teleradiology to read more films without human intervention. We've been very happy and proud to be the recipients of this award, and it just encompasses what we stand for: transparency, ethics, integrity, evidence-based practice, and we wish to continue the same.
Important is the consumers, how the the industry or the various players which are there in this segment are helping the consumers to achieve their goals. Well, there are a lot of focus on education, on creating awareness through the various fitness apps which are there. And if you look at the apps which are available in the market, now that is what is creating the awareness. As long as the consumer is your focus, and with the constant education, constant training, being in touch with them, and looking after their personal needs, what are their nutrition needs, that is what makes the difference. And we in Herbalife strongly believe, with the focus on our consumers, we continuously train our distributors on what are the rising trends in the wellness and in the nutrition industry. And we strongly believe that if a distributor is well trained, he can pass on that knowledge, he can create that awareness to the consumers. And of course, by the second major thing I would say is, we at Herbalife strongly believe that having the right set of products which are I would say for the palatable use of the consumers, like we have flavors in our Formula 1, which is the kulfi. Kulfi is typical Indian. And then we have in our fresh range, which is energy drink, which is we have things like cinnamon, we have elaichi, we have ginger. So connecting with the consumers is what is important, and that what sets you apart. So it's the education of our distributors, creating that awareness, being in touch with the consumers, making them aware, and a personal touch with the consumer, and the right set of products which attract them, that's what makes the difference.
The ET Best Healthcare Brands was a culmination of many extraordinary sessions where industry stalwarts and stakeholders came together to recognize excellence and share some of the best practices that will drive the healthcare industry to the next level in India.